Hello, I'm Carolyn Griggs, and I'm the Director of Care Coordination Training for the Bureau of Family Health Services. Cystic fibrosis is a disorder that is included in the newborn screening that's done when children are born. The presentation you're going to hear today is some information about cystic fibrosis and what you'll need to do if you receive a referral on a child who has tested positive for cystic fibrosis in newborn screening. Stacy Thrasher is the CF Newborn Screening Coordinator at Children's Hospital. She is going to briefly talk with you about the disease and the process that the patient and family will go through if they need to go to the CF Center at Children's Hospital. The other person that's going to talk with you today is Tracy England. Tracy is the newborn screening nurse who will be following CF babies and sending you referrals. She will briefly talk with you about this process. When they finish, then I will talk with you about what you will need to do in a general way once you receive one of these referrals. So we'll get started with you, Stacy.
Okay, thanks, Carolyn, and thank you for allowing me to participate in this training today. And I want to start off by just telling you a little bit about cystic fibrosis, some basic facts. As you may know, CF is a genetic disease, and both parents of children with CF are carriers of the CF gene. So if two parents are carriers of the CF gene, they have a 25% chance that their child will have CF. And as you can see, this is illustrated in the diagram on the slide. Some other basic facts about CF. The genetic problem in CF causes thick, sticky mucus to build up in the lungs, the digestive system, and other organs. This mucus causes several different problems all over the body, but the majority of the problems that we see are chronic lung infections and digestive problems, which lead to poor growth and development. About 1 in 25 Caucasians are carriers of the CF-causing gene, and about 30,000 people with cystic fibrosis have cystic fibrosis in the United States today. There are about 1,000 diagnoses each year, and we have about 25 to 30 new diagnoses each year here in the state of Alabama. The encouraging thing that's going on in cystic fibrosis right now is just the progression of research and new therapies that are available to patients with CF, and so we're seeing that patients with CF are living much longer. There are about 40,000 patients with CF over the age of 18 in the United States today, and the median age of survival is now 37 years. So you may be asking, why do we need newborn screening in CF? And I'm going to talk to you a little bit about the importance of early diagnosis in cystic fibrosis. One of the things that we see a lot is that we diagnose children who are very malnourished, and so we're hoping by diagnosing babies at birth or soon after birth that we're going to be able to intervene in terms of nutrition therapy at an early age. Also, we're going to start early treatment and prevention of lung issues and chronic lung infections to hopefully decrease the progression of the lung disease or prevent lung disease. We're also hoping that we're going to see a decrease in hospitalizations, and ultimately we're going to see improved quality of life and increased lifespan. So how is CF diagnosed? Well, during the newborn period, a blood sample is taken right after the baby is born and is tested for an enzyme in the blood that is elevated in infants with CF. If this is elevated, that same blood sample is then tested for the abnormal CF gene through a DNA analysis. If the abnormal gene is found, follow-up at our CF center or the CF center in Mobile is required for the baby and the family. Follow-up for patients with a positive newborn screen is going to include a sweat test. A sweat test is what we use to confirm or rule out the diagnosis of cystic fibrosis. There are 2 CF centers in the state of Alabama that are accredited centers to complete sweat tests. One is at Children's Hospital, which is where I work. I'm the newborn screening coordinator in Birmingham. And then the other is at the University of South Alabama in Mobile. So this follow-up will include a sweat test, which, as I stated before, is the gold standard for confirming a diagnosis of cystic fibrosis. And basically what it does is it measures the amount of salt in the baby's sweat. After the sweat test, the patient and family will have a clinic visit where we will discuss the results of the sweat test and to provide education for the family about the results. Just to give you a little bit more information about the sweat test, it takes about an hour, and we use a special machine that causes a small part of the baby's arm or leg to sweat. Basically, they put a piece of gauze or pad on the skin to collect the sweat. The gauze or pad is removed after about 30 minutes, and during this time, the skin may feel a little warm or tingly. It may be a little uncomfortable, but it's not particularly painful, and the baby may cry because of that. It's unusual feeling. It's a little bit uncomfortable, but it's not particularly painful. So there's a couple of different results that we can see from the sweat test. One would be a negative result, which means that there's a normal amount of salt in the sweat, and these babies do not have CF. The other result is a positive result, which means that there's an abnormal amount of salt in the sweat, and these babies do have CF. In these babies, the diagnosis is confirmed, and they will need to be followed by a CF specialist. Another result can be a borderline result, which means that the amount of salt in the sweat is between positive and negative, and these babies are going to need a follow-up sweat test and other testing to either confirm or rule out the diagnosis. And then finally, sometimes we will see that we are not able to get enough sweat from the baby to measure, and we call this quantity not sufficient, or QNS, and these babies will also need a subsequent sweat test to confirm or rule out their diagnosis.
Thank you, Stacy. Now I'm going to talk to you about the newborn screening process. What I'm going to talk about is if the test is positive, or at some point the test may become unsatisfactory, means that it's too old or they didn't get enough blood in the spots. It may be different things. But what happens first is the lab contacts the newborn screening division within 2 days. And they have already contacted the physician of record or the hospital or whoever it is that did the test. They will let them know that same day that they get the results. Next, the newborn screening coordinators will contact the physician of record. Normally the lab will send us the report and they will have the physician listed. So we will contact that physician, and we ask that physician to contact the family. And we will ask them to do either one of two things, and it will be either to repeat the screen, and of course that is because it may be unsatisfactory, or schedule the family for a sweat test. And the reason we ask the physician to do this because we want them to have that face-to-face visit. Next, the newborn screening coordinator will repeat a call to the physician of record within 5 days to see if the needed test has been scheduled. And the reason we do that, we give them time to contact the family and allow the family to come in to the office to have that visit. Also, if there is no follow-up test that has been scheduled by the physician of record, or if there is no physician of record, then the newborn screening coordinator will contact the family directly and will schedule the needed test. It may be that sometimes that they were not able to get up with the family, and after those 5 days, if they have not been, then it's going to be our responsibility to try to contact them directly. And what we will do then is contact them to have them to go back to the physician of record, or we will make the appointment so they can go for the sweat test. The newborn screening coordinator will then refer for care coordination if we're unable to locate the family. Now, what we would like for your role as care coordinators to do is first to try to locate the family. Now, when we do the referral, we're going to specify specifically what we want you to do in that referral. So the next thing we would ask that you do is to facilitate, which if you would just, the child receiving a repeat screen at the local physician's office, we would like for you to get that facilitated, to get the child and the family into that physician's office to have that test repeated. Or if the child going to the CF newborn screening clinic for the sweat test, go ahead and facilitate that appointment to get that test done, because it's very important. The earlier we reach them, the earlier they can get in to have their testing done.
Thanks, Tracy. I'm going to talk to you a little bit about your communication with the family. You know, your role in helping us to get these families in for the screening that they need is critical, and the way that this information is presented to them initially can kind of set the tone for how that experience goes for them. So I wanted to share a little bit of information with you about that. If at all possible, provide this information face-to-face. You know, people that are finding out that their child has a positive newborn screening test or result, it can cause a lot of anxiety, and so if at all possible, it's most helpful for the family to be able to provide that information face-to-face, to be able to answer questions for them that they may have. It's also important to remember that the time between notification of the positive newborn screen and the time that they get the sweat test, which could be a week or two, is very stressful for families. If you are the one that has communicated that information to them, it may be that they call you and that they have questions for you about how this process is going to work, even though you may have already communicated that information to them. But it's important for you to understand that this is an anxiety-provoking time for families of newborns. If at all possible, when you're communicating this information with families, you know, give good news first. Our friends in the Journal of Pediatrics in 2005 came out with an article that said that if you can give good news first. So the good thing about newborn screening and cystic fibrosis is that these babies are going to be healthy. You know, we are catching them before they have the progression of the disease, and so that's one thing that you can communicate with the families is that, you know, right now your baby is doing well, and we want to make sure that your baby continues to do well. Then another important thing, you know, a lot of families, as soon as they get this information, they will go straight to the internet to find more information, and it's real important for you guys to communicate with them that there may be inaccurate information on the internet, and to lead them to internet sites that have up-to-date educational information for families. We've kind of come up with somewhat of a script for you to use if it's helpful for you as you're communicating this information to families. And basically, you know, you can say something like, your baby received a positive newborn screening for a disease called cystic fibrosis. And then it's going to be real important for you to stress with them that only about 10% of the babies that have this initial positive screen will actually have the disease. So that means that 90% of the babies that we see in our clinic for a follow-up sweat test will not actually have CF, but will probably be healthy carriers of the CF gene. Let them know that you're going to need to make an appointment for them for a follow-up sweat test, either at Children's Hospital or at the University of South Alabama. And then let them know that you're there to let them know when the date and time of the appointment is, and to try to answer questions that they may have in between the time of you initially communicating that information and then the time of their sweat test.
Thank you. I really appreciate both of you being here today and talking with us about this very important information. What I'm going to talk about now with you is just some basic general things. When Tracy sends you a referral, as she said, she's going to be very specific about what she wants you to do. So what we're going to talk about now is just the general procedures that you'll follow. So let's say that you have received a referral from Tracy for a baby who has had a positive cystic fibrosis screen in newborn screening. You'll receive this referral through the CCRS system that you're very familiar with. It will be titled Metabolic, and the difference will be that the diagnosis will be cystic fibrosis, and the referral source will be Tracy England. You will notice that it's different from Cindy Ashley, only by name and phone number. But you will need to pay close attention to the diagnosis and also look at the referral source whenever you get a metabolic referral. This is the information that you'll need to put into your ACORN Patient First referral form for the referring provider. You're very familiar with how to do that, but you simply take that information from the CCRS referral and enter it into ACORN's referral form, being careful to put the correct phone number for Tracy and also the fax number, because you know that this is the way that you will get reports to Tracy when you've done the work that you need to do. You'll be sending her reports, and it'll go from your computer. That's why this fax number is so critical. As we've said before, when Tracy creates this referral, she is going to be very specific, and you'll see the specific instructions in the box on the CCRS referral. Once you get those directions, then remember that our objectives are going to be to find the child and the family and help the child either get to their doctor's office for a repeat sweat test or to get to a CF center to have, for a repeat screen is the reason they would go to the local physician's office, but they would need to go to a CF center to have a sweat test if that's what they needed. So let's talk first about the child who may need to have a sweat test. What you'll want to do is talk with the family about the positive screen and the need for the sweat test. And you, with your very good skills for doing care coordination, will know what you need to do to help this family with this very difficult news. I'm hoping that the information you've received today from Stacy will help you to frame the information that you share with the family in a way that will be helpful. You'll need to develop your own way of talking to the family about this information. So once you have talked with the family about how the screening test was positive for CF, then the next thing you'll need to do is talk with them about the CF centers and help them to let you know which CF center they want to go to. Obviously, the closer the CF center is to where they live, it could be easier for them, but there may be another reason why they want to go to one that's farther away, and that's okay. Just find out which one they want to go to. When you get back to the office, what you want to do is make an appointment at the CF center, and then you'll need to get back to the family with that information. You want to be sure that they understand when they need to go, and then look for any barriers they may face in getting to that appointment. And that's what we called active monitoring. You'll need to look and see if they need a reminder. You'll need to find out if they need help with transportation, or are there other barriers? Do they have a lot of children and they need somebody to help take care of those children while they take the baby to the CF center? Can you find a volunteer or a church or some kind of situation that would help with that problem? there are many things that could get in the way of a family getting to either Mobile or Birmingham, and active monitoring means to identify those barriers and work through those barriers with the family. In essence, active monitoring is doing good care coordination. Once you've helped the family to have that appointment to get the baby tested, you want to follow up in 3 to 5 days to make sure they made it to the CF center. And then you want to ask the coordinator what the test results were and if they can think of anything else you need to do to help the family. You'll want to know the date and time of their next appointment. If a baby tests positive for cystic fibrosis in the newborn screening process, once they've had that sweat test, then Stacy is going to connect them with the CF Center for follow-up care. At the CF Center, they all have social workers who will actively work with the families in regards to whatever their needs are. Also at the CF Centers, there are CRS counselors that will be located at those clinics, and they will also be helping the family. So it may not be that the family needs anything further from you once the diagnosis is made, but they could. Certainly what we always want to do is ask the coordinator if she can think of anything, and also ask the family if they have any needs that they can think of. And if, in fact, once the child is diagnosed with CF, if the family does have further needs, then what you'll need to do is coordinate with the social worker at the CF Center as you work with the family further. Now, let's talk about what to do whenever the child has an invalid newborn screening test, and what you need to do is to get the child back to the family doctor. What you'll do is tell the family that their baby needs to have another newborn screening test, that the initial one that they had in the hospital was invalid. And what I understand is that when the newborn screening nurses have told families about that, then they inevitably want to know why, what was wrong with that test. Well, the truth is it could be a million things, and Tracy will have written down in the referral what was wrong with the test. And you need to tell the family. I mean, it may have been that it was collected before the baby was 24 hours old. It may have been the specimen was not evenly distributed. The filter paper could have been scratched. It could have been one of many different things. But it will help the family if you share with them what was wrong with that initial screen. Just like with children who need to go and have a sweat test, we want to actively monitor if they need to go to their family doctor. We want to assess for barriers in getting to the doctor, and we want to assure that the family knows about the appointment time and has transportation to the appointment time. Again, we want to actively monitor to follow up in 3 to 5 days to make sure they got to the family doctor and did get a repeat screen. What you'll want to do is ask the doctor's office or the nurse the results of the test, and once you find out the results of the test, ask the doctor's office if they've arranged for the sweat test, and can they think of anything you need to do at that point to help the family. Get the date and time of the sweat test at the CF Center. Then contact the family and ask them if there are any barriers in them getting to Birmingham or Mobile. So in summary, the care coordination process for CF newborn screening referrals is to locate the child as soon as possible, and once the child is located, actively monitor until the testing is complete. Actively monitoring means that we want to assure that appointments are made and kept in a timely manner. Testing is complete for cystic fibrosis when a child either has a test that says they don't have cystic fibrosis, or when a child receives a positive sweat test and is connected to the Cystic Fibrosis Center for ongoing follow-up. Once testing is complete, then you do go to the family, as we always do, to assess whether the family has other needs aside from the cystic fibrosis. If they do, and if you need to continue to work with the family, that's when you would ask the family if they would like for you to continue to work with them. And if they say yes, then do a psychosocial assessment and case plan and proceed to provide care coordination services as you would in normal fashion. If there are no further needs, then what you would do is write a discharge note and close the case using activity type 7. We've done a lot of talking about what you need to do with the family. Now let's talk a little bit about how to write these reports. When we've found the family, or any time that we have been able to do something that's important in regards to doing what Tracy has asked us to do, you need to send a report. You don't want to wait 30 days or 90 days to send a report. When you find the baby is a time that you want to make a report. When you find the baby and schedule a test. When a test is completed, or after 30 days of unsuccessful attempts. Any of those times you would want to go ahead and send Tracy a report. When you send Tracy a report, you just want to be very brief about the information that you provide. Just like you do with newborn hearing, you need to talk about the type of test, who the provider was, the test date, the test results, and the date and time of any follow-up CF appointments. Remember, reports should end to Tracy whenever the CF testing is complete. So if the child doesn't have CF, but they still have needs, and you open a case and continue to work with the family, you would not continue to send Tracy reports. This is an example of a report that you would send. You would, as you can see, you would say that the repeat newborn screening test was completed, the date of the test status, the performing provider, and any follow-up tests that were scheduled. So this completes our training of cystic fibrosis. I hope that this has been information that will be very helpful to you as you're working with families who have a baby who has a positive CF screen. If you have questions after you view this video and you want to contact either Tracy England, Stacy Thrasher, or myself, please do contact us. Our contact information will be provided at the end of this presentation. So thank you, ladies.
Thank you.
And we look forward to your knowing what you need to know in regards to cystic fibrosis.